here he's got two different colors, and that's what I'd like to see. So I'd like to see just red and then two green lines. If you want to use 3 lines, that's fine, but ultimately I'll know if you've done 2 lines. Don't give me the color of the actual age. And I'll explain that to you in a minute. Because then some people give me tracings with 3 lines or 4 lines. You know, I don't want that. I don't know which line is what. I just want the, you know, what is it, the alpha and the omega, beginning and the end, is that right? So let's look at this individual. This is a tracing where maxilla is good, mandible is good, correct? The patient is 21, and where is their vertical? Right on the 18 arc. So is this a good looking face? Without even seeing the patient? Absolutely. And how do you kind of know that? Look at the 4 major planes. Where are they going? Almost spot on. So this is what he would call skeletal 1. Skeletal 1 balanced. And be careful, because some softwares say they do the Jefferson Analysis, but they can't really counter skeletal 1 BR or BP. How do I mean? What I mean? I use Dolphin. I use the Jefferson component on Dolphin. The problem with Dolphin is that when I do a tracing that's class 3, clearly class 3, you can see it, it'll trace up as BP. Why? Because in that particular class 3 tracing, the maxilla is retronative, right? So what you need to do is work with a company or do it by hand where you can say skeletal 1 correct position, or skeletal 1 retrusive, or skeletal 1 protrusive. Do you understand that? So down the bottom here, Jefferson has BR and BP. But you can be BR and BP and class 1, 2, or 3. You can be BR and BP and class 1 long. So there's 3 variables in the Jefferson analysis. There's this, right? There's that, okay? And then there's the relation of maxilla to mandible. So an accurate Jefferson analysis could be, my patient is class 2B, biskeletal retrusive short. Lost anyone? Right? All explained in his article, in his manual, but the plug. All right. So let's now look at how you can do the vertical for the age. But I don't want this. I'm just throwing this in because people ask me this. If you want to, if say you have a 12-year-old patient, that's a common age for a Ceph, and you want to know exactly where they are vertically. Well, what you do, you subtract 4 from their age, and you multiply by 0.75. And that millimeter measurement is what you'll add to the 4-year-old arc. So for the 18-year-old arc, you add 10 millimeters to the 4. Happy? If they're 12, like this patient is, we start with the 4. How do we get the 4? We go from superior orbitali to ANS, like that. Then we take 12 minus 4 is 8. 8 times 0.7 is 6. So if we add 6 to that arc, I can now draw a 12-year-old arc. But you know what? To me, I'm happier just to look at the vertical between 4 and 18. Does that kind of make sense? So when we come to Jefferson classification now, this is what we have. We have the ability to be ideally skeletal 1. That's our goal, isn't it? That's our patient who, if they come like that, could be our Invisalign case because they just may have some crooked teeth, right? But they got good facial proportion. That's what we'd like our kids to look like. Yes, no? But in real life, that's very rare, okay? Greg will give a talk in a moment. He does a lot of maxillofacial surgery. We determined where the jaw should be moved by this analysis. Does that make sense to you? Right? So effectively, if I have a 40-year-old that's class 3C, I'm not going to be able to use a face mask. Yeah? But Greg can determine how far to bring the maxilla forward, how far to bring the mandible back to get them into skeletal 1. You understand that? Right? Now, here's where it really works. These 3 girls are all class 3, according to Angle. But their mechanics are all different. So let's look at the first girl. If we look at her tracing, what do we see? Maxilla is normal, mandible is forward, Pagonian forward. So that is already a skeletal 3B. Happy? Now the girl's 19. There's her 4-year-old arc. She's below her 4-year-old arc. So that pretty much tells you she's got a short face. Does that make sense to you? So her mechanics will be extrusive in nature for the vertical, low torque bracket, because look at those upper incisors. They're proclined to compensate for the big mandible. Does that make sense to you? Right? And I won't be using a face mask on her because her maxilla is normal. So she might be a case where I will take out lower 8s, place TADs, and en masse retract 7 to 7 with class 3 elastics to open the vertical. You know? So you may not understand those mechanics. You'll learn those when I do the lectures, but at least you know why those mechanics. I can teach you the perfect mechanics, but guess what? If you put the intrusive mechanics I teach you on a low angle patient, all of a sudden you're going to ruin the case. Here's another girl, also class 3, but where's her maxilla? And her mandible is forward. So she is a type 3C combination. And if you look at her vertical, the girl's 13, but she's already on her 18 arc. Does that make sense? So that makes her, even if you can read, it makes her class 3C long. Happy with that though? Yes? Mechanics different for this girl, aren't they? She will need a reversible face mask without a chin cup because of her vertical. You got it? She will not have class 3 elastics. Totally different to the last girl. Yet, according to Angle, they're dumped in the same hemisphere. This girl, where's her maxilla? Retrognathic. Anyone can pick that, right? I pay my son $1 for doing the tracing, and now to give him some incentive, I pay him $2 if he can get the diagnosis right. Seriously. He's almost there. 8 out of 10 he gets right. He has that chart, and it's pretty easy. He looks at the trace, he looks at the chart. He's just confused about the BP and BR. Yeah? Okay. So this girl, would you agree, is type 3C? Yes? Very mild C, because she's almost on the money there, isn't she? So I wouldn't hound you if you said type 3A. Okay? Vertically, though, she's definitely short, isn't she? But different mechanics altogether for her. Right? She could have a face mask with a chin cup, because as you retract the maxilla, we want to increase her lower anterior face height. She can have class 3 elastics. She will have normal torque upper brackets because of the angulation, but probably high torque lower to compensate for the class 3. And these mechanics I'll teach you. But you need to tell me, in your case, this. So if you want me to give you the right diagnosis and treatment plan and how to do the case, you have to say, right, Dr. Mahoney, I have a dental division 2, skeletal class 3C, short with stage 6. Growth is finished. Do you understand that? All right. What is this? It's basically a roadmap. You know, if you didn't have GPS and you had to get from here to North Sydney, you're going to need to get a street directory out and try and find the most efficient way to get there. Orthodontics is like that. You know you have this patient that's class 2. You know you ideally want class 1, neutral vertical. This is the roadmap to get you there. Okay? So let's look at just some more figures, and then we'll look at the points, and then we'll do a tracing after Greg's lecture. Okay. So this girl, she is 12, and if you do her tracing, where's her maxilla? Retrognathic? Yes, no. Come on, you need to really kill this. And you've really got a 50% chance on these questions. Yeah? Whereas when I come to vertical, you've got a 33% chance. Okay, where's her mandible? Right, so therefore, you would say that she is biskeletal retrusive. Does that make sense? But you don't know whether she's class 2 biskeletal retrusive or class 1 or class 3. You'll work that out by looking at maxilla to mandible position, which is what some people call A and B difference, SNA and SNB, or you can use analysis that was developed in South Africa called the Wits analysis, where you just do your occlusal plane, drop a vertical from A point to the occlusal plane, a vertical from B point to the occlusal plane, and if it's class 1, the lines will be on. If it's class 2, A point will be ahead. If it's class 2, no, we'll teach you that, right? But right now, this girl needs as much forward movement as possible. Who would agree? This girl is definitely a non-extraction profile. Happy with that? What's her vertical? Well, she's 12. I think it's pretty normal. To prove it, what would you do? You'd go 12 minus 8 multiplied by 0.75. It'll give you 6 millimeters. You'll add it to the 4 and you'll see. But, you know, I think... What did I say? Right, I meant 12 minus 4. All right? 8 times 0.75 gives you 6. Just seeing if you're awake there. All right? Okay.